Hi, I'm Dr. Johnny Nelson with Raleigh Upper X in the Bone and Joint Surgery Clinic, and this video is about healing after shoulder arthroscopy, also known as a shoulder scope procedure. So if you're watching this video, you may be considering or scheduled for a shoulder scope procedure with me or with somebody else and just want to learn more about the procedure. So healing after shoulder scope surgery is a simple thing overall. I think that the main thing is understanding different facets and thinking ahead to what your life will be like in the first few weeks, especially after a shoulder scope procedure. So as I mentioned in some other videos, a shoulder scope surgery is outpatient, meaning that you go home that day after the surgery. So this healing will be done at home. I have other videos that will talk about the risks of shoulder scope procedures, what happens on the actual day of surgery, and what a shoulder scope actually is. But this video is really about just the first few weeks and mainly the first month after healing after shoulder scope surgery, and especially in those first few days, the experience of healing after a shoulder scope procedure. So first of all, after you get home, and again, like I mentioned, there'll be other videos that describe more about what happens on the day of surgery. When you get home, the main thing that you're going to be trying to anticipate is going to be pain control, right? So shoulder scope surgery, our ability to control pain and to do this safely and to do it well, but also do it in a way that keeps patients comfortable, has gotten much better in the last decade or so. A lot of that is thanks to our anesthesia colleagues who do great nerve blocks, right? So nerve blocks are really helpful, and almost always we do a nerve block with shoulder scope surgeries. So that's going to really help with your pain control in the day after the shoulder scope surgery. So when you get home, you likely will still be numb. The nerve blocks that they do actually are great, not only because they keep you comfortable during the surgery, but they'll keep you comfortable even sometimes up to 3 days after the surgery, and they wear off very slowly. So pain control is still a concern, but it's nothing like it used to be. So when you get home, you're going to be in your sling, you're going to have your dressing on, as we discussed in the other video, and that arm will still be numb. Now, the main thing you need to understand is that even though you're feeling great, right, you're not going to have any pain, that nerve block's going to be working, you may have some medication still on board from the surgery. I need you to act like you are hurting. And basically, I want you to behave like you're hurting. I mean, I want you to lay down. I want you to lay back. I want you to put a big bag of ice on your shoulder, and I'll talk about ice here in a second. And I want you to start your foundational pain control. So everyone who has shoulder surgery with me will get a copy of my pain control plan. It's like a little pyramid. And so when you get home, I'm going to want you to start this foundation, right? And that consists, and you can find this on my website, RaleighUpperX.com. It's around the clock, Tylenol, ibuprofen going back and forth, right? So that's your foundation. So every 4 hours, 600 to 800 milligrams of ibuprofen, as long as your medical doctor says it's okay, preferably with food. And then going to the Tylenol, 1,000 milligrams, 4 hours after the ibuprofen. And then basically every 4 hours rolling back and forth, right? So of course you need to clear these with your medical doctor, your primary care doctor, but that's your foundation. So when you get home, even when that arm is numb and you're feeling really good, you're having zero pain, I want you to be doing this until you feel that block start to wear off. Like I said, it could be 24 hours, sometimes it's even up to 3 days. I want you to be doing this around the clock, Tylenol, ibuprofen. Now, we also will be prescribing some stronger pain medicine, and typically I will use an oxycodone, which is a straight narcotic medication. We ask you to start with a low dose, something like 2.5 milligrams. If you're a bigger person, a bigger guy, sometimes you can even take up to 10, but usually we ask you to start really low. And you will be prescribed at least some of that after the surgery. And again, we will personalize your pain control plan for every patient, but typically this is what we do. When you start to feel that nerve block kind of wearing off, you feel a little ache in the shoulder, which is really all it usually is. I want you to take 1 tablet of that. And you can take 1 tablet of that. And the goal here is you want to give the sensation time to mature. You want the nerve block to wear off. You want to continue this foundation at all times, no matter what. Until your block is completely gone, you'll be doing this at all times. Only when you feel that nerve block wearing off should you consider taking some of this. Some patients don't even need to take the oxycodone. They don't even need to take the stronger stuff. And so sometimes this is all you need. And if you really stay on top of things, that really might be the case. But if you do start to feel that ache, and especially if it's right before bed, it might be a good idea to take a small dose of the stronger pain medicine if we prescribe it to you. And as that nerve block wears off and you know where you are, you can kind of titrate up and down the pyramid based on how much discomfort you're having. If you're really not having very much, the ice is really doing it, the foundation here is really doing everything for you, then you might not need that stronger pain medicine. So the stronger pain medicine does diminish pain, but unfortunately it has its side effects. It depresses your respirations. It can make you constipated. And so a lot of problems with those medications. They do help bring your pain levels down, but you want to avoid these if you can. And again, I just want you to readjust everything. It's safe to take all three of these together. So that's a little bit about pain control. If you have more questions on that, then certainly ask me at your preoperative visit. The other things that are really important for pain control include ice, right? So icing is very important after shoulder surgery. When you first get home, you're gonna have some big bulky dressings on your shoulder. You still can ice through those, but ice is a little bit more helpful, especially when you get those dressings down and off after about 2 days. And typically your nerve block is still gonna be working during that time. But icing even over the dressing, and sometimes we do what's called a polar care unit, which is a special kind of shoulder ice machine that we can get you before the surgery. That can be really helpful as well. I do want to mention a few things such as swelling and bruising. So I've said in the past, and I tell most of my patients, that surgery is a controlled injury. Your body sees a surgery just like it sees an injury, and it's going to respond to that surgery just like it would an injury, right? And how does your body respond? It responds by things like bruising and swelling. Right, so having some bruising in your shoulder and especially down into your arm is nothing to worry about. And even sometimes patients will get a little bit of bruising in their chest wall, because when I do this surgery, I blow your shoulder up with fluid, and in response to what I'm doing, right, there's a little bit of blood in that shoulder, and that blood will seep through those tissues in your chest wall and even down into your arm and wrist. So it's not unusual for patients to have some bruising in that arm and in their chest wall. Nothing to be worried about. That's just your body breaking down that blood to take it back to your liver. Swelling is also very common. You will have swelling in the shoulder. That's a very normal thing. You may have some swelling in your chest wall and in your armpit. You also will probably almost definitely have swelling all through your wrist and your hand. That also is really important. That's why I instruct every patient, even as soon as that nerve block wears off, I want you to be coming out of your sling about 3 times a day at least, if not 5 times, to work on your elbow range of motion. So straightening that arm out by your side, letting the elbow come out all the way straight, right? Doing that a few times. And then I want you to do some palm up, palm down type motions in your forearm and making power grips, right? So the main thing to understand is that getting rid of that fluid in your arm, some of that fluid is from surgery, some of it is just from not moving your arm, right? And you've had a block and your shoulder is healing and you're not moving your arm. So you have to move your arm and fire your muscles, and that will pump the fluid back out of your hand and your wrist. So that's really important. Numbness, you can also have some numbness in the arm, especially from the nerve block after the surgery. Nerve issues directly related to shoulder scope surgery are very rare. And so typically if you have numbness after the surgery, it's either due to the swelling that you have from the fluid we used during the surgery, or it's from the nerve block. Typically, persistent numbness for even several weeks after the surgery is nothing to worry about. I do want you to tell me about it if you're having it, but typically it's something that we observe. So I want to move on to dressing. So when you get home, you're going to have a big dressing on your shoulder. It's a big absorbent dressing with tape. Typically that will come off 2 days after surgery, right? So you just peel that dressing off. Underneath, you'll have those little poke incisions with some sutures in them. And you can cover those with a Band-Aid if you like, or you can leave them open to air. As soon as you get that dressing off of there, you can start showering. So take your sling off, you have your dressing off, you can get in the shower, let water, including soapy water, run over those incisions. Make sure when you're showering, you keep your arm by your side, either like this or hanging down. You shouldn't be using your arm to wash yourself at all, but soapy water running over the shoulder is definitely okay to do. I don't want you to immerse the water or the shoulder in any sort of water, including bath water. No hot tubs, no pools, no lakes, nothing like that until you're cleared by me. And usually that's around 2 weeks that will let you go back to that as soon as your incisions are fully healed. I want to talk a little bit about the sling. I do have a separate video about using your shoulder sling. It's called an ultra sling after surgery. So really consult that video about using your sling after surgery. But the main thing is that typically for the first 2 weeks, you're going to be in the sling full time, right? The only reason you should be taking off your sling is to do any exercises that I instruct you, either hand, wrist, and elbow, right, to straighten that elbow out. Phase 1, phase 2 shoulder exercises that I also have in other videos. Those are really the only reason, and dressing, obviously, putting on deodorant. Other than that, I'm in the first 2 weeks, almost every patient's in a sling full time. So just look at that video. That video tells you how to use the sling, when you can take it off, you know, resting and sleeping and that sort of thing. Sleeping is another thing that I do want to briefly mention. I get a lot of questions about sleeping after shoulder surgery. Typically, we want you to kind of, in the first few nights, especially while your nerve block is wearing off, sleep not fully flat, but in a recliner, right? So semi-upright. It'll help a little bit with the swelling there and encourage that fluid to kind of not pool around your shoulder and make you more painful. It also it works a little bit better with the sling and everything, because when you lay back, you have a tendency for your elbow to fall back behind you. And so we do typically ask you to sleep in your sling, especially in the first few weeks, and that pillow on the sling will help your elbow to fall back. But reference that sling video and I'll tell you a little bit more about that. Activities, as I mentioned, most of the time after shoulder scope surgery, we're really not wanting you to use this arm for anything in the first 2 weeks, okay? And for some patients, that's even longer than that. That's 4 weeks or sometimes even 6 weeks where we say, don't use the arm, okay? Now, I will individualize your plan at your first follow-up visit. I will tell you, okay, at this point you can do this, but not this. But for the most part, your activity should really be limited with this arm. I will have some either phase 1 or phase 2 shoulder exercises, again, in a different video that you can watch that I'll tell you when to start those. I get questions about cardiovascular exercise, so things like walking and stationary bicycles. By all means, that is safe to do and very encouraged. As soon as you're able to get back to those things, and you can do them safely and you can do them with your sling on, you can get back to those cardiovascular activities. I don't want you to break out into a really heavy sweat though, because the incisions can get a little macerated, a little yucky. And so we don't want you to get into a really heavy sweat, but certainly cardiovascular activities, you know, because I know some patients love to work out and they get a little stir crazy, and it's just very healthy to work out. So I encourage you to do that, walking, stationary bike, but you do need to wear your sling. And then follow up. So I will be seeing you around 2 weeks after surgery. I want you to come back and see me. We can check your incisions, usually get sutures out of there, make sure all your nerves are working well, answer any questions that you have, and I'm going to show you your pictures. Have you bring those pictures from the surgery to my office, and I'll go over exactly what I found in your shoulder and what I did to treat your shoulder problems. So this video was about healing after shoulder scope surgeries, and hopefully it kind of touched on all the main points. If you have further questions, of course, give us a call. Consult my website, my YouTube channel, and so RaleighUpperX.com, and hopefully it's helpful for you, but you see you around.